Hi, now we will be testing for tendinitis. If you believe there is tendinitis, you want to first isolate the tendons that are a problem. On the elbow, you have the lateral epicondyle drawn here. This is a common site for the wrist extensor muscles originate from. On the other side, we have the medial epicondyle right here. This is a common site for wrist flexors. So when you're first testing for lateral epicondylitis or tennis elbow, the first thing you want to do is place your thumb on the lateral epicondyle. At the same time, you apply resistance to the extended wrist like this. If there is any pain on this area on the lateral epicondyle as you apply resistance, this is positive for lateral epicondylitis, also known as tennis elbow. For medial epicondylitis, you want to check the medial epicondyle right here. So as you apply resistance to the flexed wrist as you try to pronate it, if the patient has any pain at this area, the medial epicondyle, as you pronate it and apply resistance, this is positive for medial epicondylitis, also known as golfer's elbow. Next, we're going to be testing for tendinitis on the wrist. So on the wrist, as you see here, I have drawn the 6 compartments. We have the first compartment right here, and in this compartment, we have the abductor pollicis longus and the extensor pollicis brevis. On the second compartment, which I have drawn right here, we have the extensor carpi radialis longus and the extensor carpi radialis brevis. On the third compartment here alone, we have the extensor pollicis longus. On the fourth compartment, following right here, we have the extensor digitorum and the extensor indicis, which I have drawn right here. And as you can see, the fifth compartment is drawn over here. On the fifth compartment, we have the extensor digiti minimi. On the sixth compartment of the extensor side, we have the extensor carpi ulnaris. Again, the most common to get inflamed are the abductor pollicis longus and extensor pollicis brevis as they run here through the first wrist dorsal compartment. So now we're going to perform the Finkelstein's test. This is done by gently flexing the thumb like this and ulnarly deviating the wrist like this. If there is any pain here, this is positive for Finkelstein's test. The next test is the radial-sided tendinitis, also known as Decker-Vein's test. This is the intersection syndrome, where the first dorsal compartment intersects with the second dorsal compartment, which they intersect somewhere right here. So when you test for this Decker-Vein's assessment, you want to apply resistance to the extended wrist and palpating at the intersection right here. Patients can also have symptoms of thumb triggering. If they try to flex and extend the thumb, flex and extend at the thumb, they might feel a pop. Patients with the digital triggering will feel pain in the nodule along the flexor tendon at the thumb, at the level of A1 pulley of the fibrous sheath. Palpation of the MCP joint while the person flexes and extends the fingers. You will hear or feel the clicking and the patient will feel pain. When examining the flexor carpi radialis or the flexor carpi ulnaris, the wrist is flexed up and you apply resistance. Do you see the radialis tendon where there's a tunnel for it right here?